8:07. This is Good Morning Ulster. A County Antrim GP has told BBC News NI that she's hugely concerned for women who need breast cancer treatment in Northern Ireland after 3 patients in her surgery received a late cancer diagnosis. The patients are among 32 women in the Notting Hill medical practice, which is based in Whiteabbey, who were red flagged within a 5-month period this year.
Well, Dr Gilly O'Hagan says that the new regional breast cancer system is not functioning, and women here, compared to the rest of the UK, are receiving a substandard service. She says for some women, the wait is affecting their prognosis. The Health Minister, Mike Nesbitt, says he appreciates the wait is adding to patients' anxiety, but that the new regional breast cancer treatment is beginning to show improvement. He says there's evidence that most are having to wait 7 weeks. The NHS target is set at 2 from referral to being actually seen by a consultant.
Let's speak to our health correspondent, Mary-Louise Connolly, has a story. Morning, Mary-Louise.
Morning, Chris.
I mean, this is obviously of huge concern to women, and you've spoken to some of those affected.
Yes, and they told me that while a cancer diagnosis is traumatic enough to deal with, a late cancer diagnosis can be life-changing, even life-limiting. And Chris, it's a similar story across Northern Ireland, as well as the women who attend the Notting Hill medical practice in the Northern Trust. I've also spoken to a woman in the Southern Trust who, after waiting almost 18 weeks from her GP referral to starting treatment, she's now dealing with a terminal diagnosis. And some of the women who spoke to me have started chemotherapy, others are waiting for a start date. Understandably, Chris, none of these women wanted to be interviewed, but those in the Notting Hill practice in Whiteabbey did give their permission to Dr Gilly O'Hagan to speak on their behalf. In a 5-month window this year, 32 women were red flagged from this one practice in Whiteabbey. Dr O'Hagan says the wait is causing patients further trauma.
We see a lot of women with breast lumps, and we've referred red flag 32 women from in the past 5 months. Out of those, 9 are still yet to be seen, so all the patients from October. The ones that have been seen, 3 of them have a positive breast cancer diagnosis, and all of them waited minimum 8 weeks to be seen, and one actually had to go privately. The waits are just horrendous, and I'm hugely concerned for our patients and how these delays are going to affect their outcomes. I mean, that used to be obtainable, but I was so shocked. I think that's why this has come about. I was so shocked. I referred my patient in June and she was seen in September, and I couldn't believe it. It's just horrendous. It's a failure of the pathway, and it's a complete breach of safety.
Chris, breast cancer waiting times have been increasing here for like a decade. And to address what's being called a postcode lottery across the system, a regional system was introduced by the Health Minister in May, and that means there's meant to be one system operating in Northern Ireland to ensure that the most urgent cases are seen first, with women asked to attend appointments in perhaps a hospital outside of their area, even at short notice. A breast cancer consultant who works in the heart of the system told me that this new system isn't working, and there is still a breakdown in how women are being contacted and brought into the oncology service. That consultant also told me that the additional clinics that have been set up to try and tackle the problem are not really improving things. Things are continuing just to stay as they are. They also said that those delays are costing lives. And that view is supported by Dr O'Hagan, who, like so many, are seeing it all from the front line.
There's bottlenecking, so the breast cancer service has become Northern Ireland wide, and for their change, whatever has happened, they're just not meeting the targets. Whether it's lack of appointments, I don't know, but it's...
Well, is that regional service working?
No, it was never this bad before, so it's clearly not working now.
And we know, Mary-Louise, just how much work you've done to raise attention to the concerns about waiting times, but they've also caught the attention of the national charity Cancer Research UK. They are concerned about cancer waiting times in Northern Ireland. What are they saying?
They are, and they have contacted members of the Health Committee and contacted me, and they say that while waiting times in England, Scotland and Wales aren't perfect, Northern Ireland's waiting times are by far the worst across the UK. They've described our times as shocking, with people coming to potential harm. Naser Turabi told me that research shows that every additional 4-week wait for a patient reduces patient survival by an average of 10%.
We're worried about people who are waiting longer than 2 months to get their cancer treatment. And cancer is such an aggressive disease in some cases that it becomes harder to treat with time. So that has implications for patients on their survival when it comes down to it. For each 4-week delay in cancer surgery, for example, we estimate that's about a 6 to 8% increased risk of death.
Yeah, it's important to say, I mean, nowhere in the UK, I mean, England's cancer lists, for example, aren't perfect, but they're not as bad. How are they tackling the problem there?
Well, Cancer Research UK says it's not always about the money, but how that money is being spent and how the service, Chris, is being managed. For instance, we know that once patients get into the oncology system, their care in Northern Ireland is often the very, very best. But the hurdle is getting into the system, getting through to the GP, being seen by the consultant, and then your pathway being organised by that consultant. So it's about the appointment process, it would seem. And according to the women who spoke to me, they say that's where the major block is. Naser Turabi from Cancer Research UK says patients must be seen and treated as individuals.
I would expect staff in hospitals to know each cancer patient by name so that they can treat that patient as an individual and really not accept the delays that have become commonplace in the system. So that means making sure they get the treatment absolutely on time without delay.
Cancer Research UK has delivered a briefing paper to Northern Ireland's Health Committee, and among its recommendations, the charity says that the Health Minister must commit to substantially improving overall cancer waiting times within 12 months and rapidly put in place a roadmap, governance and the necessary funding to achieve it.
Marie-Louise, thank you very much.